afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing, and this will be my medication administration checkoff. So the first thing I'm going to do is show my ID and scan the room. I'm then going to start by making sure that this is a no interruption zone. So I'm going to make sure the door is closed, that I'm not taking any phone calls or talking to any colleagues unless it is necessary for the procedure. Next thing I'm going to do is verify my patient order using my patient's chart and my MAR. So I'm going to do this by using the 5 rights. So we have right patient, Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963. Next is right medicine. We have morphine sulfate and morphine sulfate. Next we have right dose, 5 milligrams. Next we have right route, IM intramuscular, and right time. Every 4 hours is needed for pain. And it has been 4 hours since the last administration, so it is time. I'm also going to compare my allergies on my patient's chart and my MAR to make sure that they are correct. So we have allergies, penicillin, and allergies, penicillin. Then I am going to perform hand hygiene. After I perform hand hygiene, I'm going to select my correct medication, which should be morphine sulfate and morphine sulfate. The expiration date is 12/20/2020. So it is good, and that is my right medication. I will then proceed to do my 5 rights again. That was right medication. So we have my patient's chart and the MAR, Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963. Next we have right time. Every 4 hours is needed for pain. And it has been 4 hours since the last administration, so it is time. The next right is right route. So we have IM intramuscular and IM intramuscular. For intramuscular, I'm going to need a 3 milliliter syringe, a 23 gauge needle, and a blunt tip cannula to withdraw the morphine sulfate needlessly. So now that I have my right patient, right medication, right route, and right time, I'm going to do the right dose. First, I need to calculate the correct dosage. So this is morphine sulfate, 10 milligrams per milliliter, and I need morphine sulfate 5 milligrams. That means that I'm going to withdraw half a milliliter of solution to have 5 milligrams. So to withdraw, I'm going to get my alcohol swab and clean the vial. After I have cleaned the vial, I'm going to remove my blunt cannula while maintaining sterility and open my 3 millimeter syringe. I'm going to take the top off of the blunt cannula and place it on to my syringe and lay it down. I am then going to aspirate half a milliliter since that is what I need for to get 5 milligrams of morphine sulfate. So I have aspirated half a milliliter and now I will withdraw my solution. I will place this into the morphine sulfate and push in my air. I'm going to withdraw half a milliliter of solution, and I'm going to get rid of any bubbles. Once I have removed all big bubbles, I'm going to show that I have half a milliliter of solution. All of my numbers rubbed off, so I just wrote where the 1/2 was. And I have half a milliliter of morphine sulfate. And that is the correct amount. So I'm going to take off my blunt cannula by using the scoop method. I'm going to place it on, remove it from my syringe, and dispose of it correctly. I am then going to take my 23 gauge needle, open it, and attach it to my syringe. After I have attached to my syringe, I'm going to verify that this is the correct dose, half a milliliter, by checking it with my patient's form and my MAR. So 5 milligrams, 5 milligrams, and half of a milliliter is 5 milligrams, since this is 10 milligrams per milliliter. Now that I have done that, I will verify with another nurse to make sure that this is the correct amount, so I'm not giving the patient the wrong amount, and they will verify my calculations. After I've done that, I'm going to do my 5 rights again. I'm going to this time check with my vial container, my prepared medication, and my MAR. So this is for Mr. Jaguar Jones. My medication is morphine sulfate and morphine sulfate. This is 10 milligrams per milliliter. I need 5 milligrams, so I have half a milliliter of solution. It will be intramuscularly, which is why I have this specific needle and syringe, and every 4 hours as needed for pain. And it is time to give the medication since it's been 4 hours since the last one. So now that I have that, I have created a label for my medication with the name of the drug, the amount of the drug, and the name of my patient. So we have morphine sulfate, 5 milligrams for Mr. Jaguar Jones. After I have done my MAR and I have verified my calculations with another nurse, I can collect my medication and collect my MAR and head to the patient's room. So, once I have entered the patient's room, I'm going to perform hand hygiene. I am then going to verify that this is my patient using 2 identifiers. So I'm using the patient's wristband now and my MAR. So to verify that this is Mr. Jones, I'll use two identifiers. So his name is Jaguar Jones. Jaguar Jones. His MR number is 417-6352. MR number 417-6352. So that is correct. And I will also verify that this is my his armband for allergies and my MAR match up. So I see that he has a wristband for penicillin, and my MAR says allergy for penicillin. So that is right. I will then ask Mr. Jones how he reacts to penicillin, and assure him that this has no penicillin in it, so it shouldn't cause a reaction. I will then take his vital signs, so I will have a baseline for checking for a reaction after I have administered the medication. So after I have done that, I will check my label with my MAR. So this is right patient, Mr. Jaguar Jones, Mr. Jaguar Jones. Right medication, morphine sulfate, right amount, 5 milligrams, which is half a milliliter, which is the dose I have. Right route is intramuscularly, and right time is every 4 hours is needed for pain, and it is time to administer, since it has been 4 hours. Now that I have that, I'm going to explain the procedure to Mr. Jones. I'm going to make sure he understands what is happening, that I'm giving him a pain medication, and I'm going to assess how he reacts to that medication. I'm then going to raise the bed to a working height for myself, and I'm going to lower the side rails so that I can work adequately. The next thing I'm going to do is put on my clean gloves, and don my goggles. So after I have done that, I'm going to make sure I can see where my injection site is. I'm going to find the injection site, which should be the ventrogluteal site. It can be found by locating the greater trochanter and placing the heel of your hand on the greater trochanter, having your thumb pointed towards the pubic area, having your index finger on the anterior superior iliac spine, and your middle finger towards the iliac crest, and you'll have a V, and that is where your injection will be. I'm then going to assess the skin integrity and see if there is any bruising on the skin. Before I give the injection, I must clean the site with an alcohol pad. By going from the middle in circular motions all the way around. While it is dry, I will wait for it to dry, and I'm going to take my medication. Since this is intramuscular and it's in the ventrogluteal, it's going to go at a 90-degree angle. I'm going to remove my cap and place it. I'm going to pull back the skin to make it tight and inject at a 90-degree angle. I'm going to aspirate for any blood return, and there is none. So I'm going to inject it slowly over a 10-second period. Once I pull it out, I'm going to put light pressure using my alcohol swab and throwing away the needle and syringe. So now that I have administered the medication, I will assess to see if there was any reaction to the medication. I'm going to cover the place back up. I'm going to lower the bed back down and raise the side rail. I'm going to ask Mr. Jones how he feels, and I'm just going to make sure that there was no reaction. After I've done all that, I'm going to remove my gloves into the trash can and perform hand hygiene. After I have performed hand hygiene, I'm going to document I'm going to document the procedure on my MAR and document how Mr. Jones did with the procedure. I will document if he had any reaction to the procedure, and that would be my right documentation, documenting the procedure and documenting how Mr. Jones tolerated the procedure. After I have documented, I would come back a few minutes later back into the room and reassess Mr. Jones to see if he hasn't had any reactions. And that is all.